My mental health was much better. My mind was in a good place. But my body was telling a different story.
I felt all people saw were my uncontrolled movements. Some mental health meds can cause
Tardive Dyskinesia, or TD.
What is tardive dyskinesia? Now, some mental health meds can cause it, as you heard in this commercial recently put out. So let's just give you a quick rundown of what tardive dyskinesia actually is. So it refers to involuntary muscle movements that occur in people that are taking medications usually for psychiatric disorders. There are a number of medication classes, though, that can cause tardive dyskinesia. And so involuntary muscle movements are part of it. Tremors can be a part of it. Muscle weakness can be a part of it. Now, if you look here in this research study, tardive dyskinesia occurs in 20 to 50%, so up to 50% of patients taking antipsychiatric drugs. And if we look at some of the other medicines, not just antipsychiatric drugs, but anticholinergics, antidepressants, antiemetics, or drugs that treat nausea, anticonvulsants, which are drugs usually prescribed to treat diseases like epilepsy, antihistamines, so if you're an allergy sufferer, decongestants, and anxiolytics, which are designed to treat anxiety, mood stabilizers, and stimulants. These are all the different classes of drugs that we know that can cause tardive dyskinesia, which brings me back to this commercial and the ass-backwards nature of the society that we're living in. Here we have mental diseases that are being treated by drugs that cause new diseases, and now we have a drug to treat the disease that the prior medicine was causing. Let's go back to the commercial and hear more of this great plan.
Ingrezza is a prescription medicine to treat adults with TD movements in the face and body. It's the only treatment for TD that's one pill once daily with or without food. Ingrezza 80 mg is proven to reduce TD movements in 7 out of 10 people. People taking Ingrezza can stay on their current dose of most mental health meds. Don't take Ingrezza if you're allergic to any of its ingredients. Ingrezza may cause serious side effects, including sleepiness. Don't drive, operate heavy machinery, or do other dangerous activities until you know how Ingrezza affects you. Other serious side effects include potential heart rhythm problems and abnormal movements.
It's nice people focus more on me.
Ask your doctor about Ingrezza, #1 prescribed for TD. Learn how you could pay as little as $0 at Ingrezza.com.
I like the way they end that commercial with learn how you can pay as little as $0. It's like the pimp on the playground, selling drugs. This one's free. I'll give this one for you at no charge. But the second one you're going to pay for. And that's kind of the way a lot of these companies get you hooked in and rung in. I go back to why are we treating mental disease with drugs in the first place, especially with drugs that can cause physical neurological disease. So again, treating a disease that causes a new disease because of the way that we're treating it. When are we going to stop with the roller coaster nonsense? Now, let's look at a few things here. These are some of the side effects they didn't list in the commercial that I think it's important for you to know. And these are common side effects that the manufacturer lists on their own website. So check this out: drowsiness, fatigue, dry mouth, constipation, difficulty paying attention, blurred vision, urinary retention, falls, gait disturbances, dizziness, trouble with balance or coordination, headaches, restlessness, vomiting, nausea, and joint pain. Is that what you want to trade? You want to trade all those symptom possibilities for reducing drug-induced neurological disease, when in fact you could just go back and look at the drug that you're taking and ask, why in the hell am I taking this thing in the first place? So let's look at that. Let's look at mental disorders and nutrition and the relationship between the two, which is probably a conversation most doctors don't have with their patients. So if you look at this research study here, again, highlighting, notably essential vitamins, minerals, and omega-3 fatty acids are often deficient in the general population in America and other developed countries, and are exceptionally deficient in patients suffering from mental disorders. So here we go. Studies have shown that daily supplements of vital nutrients often effectively reduce patients' symptoms. Supplements that contain amino acids also reduce symptoms. because they are converted to neurotransmitters that alleviate depression and other mental disorders. Based on emergent scientific evidence, this form of nutritional supplement treatment may be appropriate for controlling major depression, bipolar disorder, schizophrenia, anxiety disorders, eating disorders, attention deficit disorder, and attention deficit hyperactivity disorder, as well as addiction and autism. So again, why are we treating mental disease predominantly with drugs? Why is our first inclination to pull out a prescription pad instead of to look at a person's diet, lifestyle, nutrition? I mean, have you ever seen a young child eat sugar for the first time? What does that sugar do to their mood and their behavior? It radically alters it. They're bouncing and pinging off the walls, and then an hour later they're crashed on the floor. They're basically depressed without the depression aspect. Their physical activity's been depressed, and it all happened as a result of food. If you don't think food can affect mood, if you don't think food is a drug, then you're lost. You're absolutely lost. So I would say ask your doctor today about what diet and nutrition can do for your mental disorder before you allow them to create tardive dyskinesia by medicating you with a poison to mask the symptoms that you're experiencing without asking the real question, the important question, which is why in the heck do I have mental disorder in the first place? So I mean, where does it end? You know, let me give you an example. A lot of you are taking high cholesterol medications to lower your cholesterol. High cholesterol drugs can cause muscle pain. Once you develop muscle pain, your doctor puts you on a pain medication. Pain medications cause constipation. When you develop constipation, your doctor puts you on an anti-constipative medication. Medicines that can cause constipation also can create reflux, so then your doctor puts you on a reflux medication. Reflux medications can cause gastric bleeding and anemia, and then you're tired all the time, and then your doctor wants to put you on a stimulant. You know, where does it end? When do we end the cycle? Because, you know, most of the conditions today, especially in the elderly, you know, the vast majority of people I see are what we call polypharmacy cases, where you're on 5, 6, 7, 8 medications, and the vast majority of them are designed to treat the symptoms of the one that came before it. So again, where do we stop this madness? I think a good place to look is nutrition.